Gathering a data set can sometimes be a difficult, expensive, and time-consuming process. Sometimes a clever data scientist will come up with a proxy method for measuring something. For example, if you want to predict an election, surveying people and asking them their voting intentions will yield an estimate. Yet, if that proxy doesn't correlate with the outcome, it's not a great proxy. Contact tracing was and is an important process for SARS-CoV-2 transmission and other pathogens, but it's a very hard, difficult, maybe even impossible thing to do directly. But what about mobile phone location data? Could that be used as a useful proxy? That's the topic of today's episode.
Hi, my name is Nishant Kishore. I am a modeling fellow at the CDC. However, the work that we're doing today is primarily regarding my research during my PhD at the Harvard T.H. Chan School of Public Health at the Center for Communicable Disease Dynamics. So I recently got my PhD in Infectious Disease Epidemiology from that institution, and I'm also here representing Crisis Ready, an organization that is an offshoot of some of the work with mobility data that we produced during my doctoral studies.
Could you tell me a little bit about what the focus of your PhD was?
Sure. I was always drawn towards epidemiology, and I was doing my master's, and I really wasn't sure what I wanted to do next. My master's was at Emory University, and one of the challenges I had, or one of the pieces that I was really trying to figure out, was this kind of gap or this very sort of niche field that I was trying to work in. So I was very interested in computational epidemiology, and if you ask 10 different epidemiologists what that means, they might give you 10 different responses. And so I specifically was interested in integrating novel data sets into our existing public health toolkits. So in many cases, our public health surveillance systems and the way that we aggregate data and actually know about what's going on in the world is very heterogeneous. In some places, it's very, very good and homogeneous and standardized. And in other places, you kind of get what you get. And I was very interested in this issue first in terms of novel data sets. So things like mobility data, call detail records, but also remote sensing information, data sources that oftentimes go into other locations and other fields, sometimes for commercial purposes such as marketing, and other times it's simply used to guide disaster response and so forth. I wanted to kind of see what sort of information we might be able to get from those data sources for public health response. Could we identify locations where people needed help before actual communications came down just by using remote sensing information to look at highly affected areas or to look at differences in how people used social media or even their cell towers in response during emergencies. And so I was lucky enough to have my advisor take me on, Caroline Buckey, who'd done quite a bit of work on the integration of mobility data into epidemiological studies. And I was able to go on, work with more of these data sources, and for better or worse, have a situation like the COVID-19 pandemic come up, allowing me to use some of these new data sources in response near real time. So long story short is I did my studies in population health sciences, specifically infectious disease epidemiology, and how these novel data sources, both remote sensing and mobility data, could help us respond better and ideally save more lives or cost less morbidity.
What's it like to enter this field at this time?
It's crazy. 2 years ago, 3 years ago, when I told people I was an epidemiologist, they might have said, oh, that's a skin doctor, right? Or, oh, I'm not really sure what that is. And that's now become something almost slightly contentious. When I tell people I'm an epidemiologist, almost always they'll have an idea of what they think I do. But more importantly, they'll have thoughts on what I should be doing or the direction I should be taking with my research, which has been interesting.
You'd mentioned that some of the data, it's good or bad or maybe better than others. What makes some data more useful or better, or I guess what are the qualities you're hoping to get as a researcher?
The way I look at this is that there's some sort of natural phenomenon that we're trying to ascertain, right? And that might be something like, let's say, the rates of having a heart attack or an MI in a specific population over a certain period of time. Now, the question is, how do you get that information? Do you get that from insurance receipts? Do you get that from some electronic medical care system? Do you go and survey patients directly? All of those different avenues through which you can get that information comes with its own biases, comes with its own issues. And a big part of the job that we have as epidemiologists isn't necessarily the mathy portion of it or even the modeling, but really being very clear and concise about where these data are coming from, how they're being produced, how good of a proxy they are to the actual measures that we're interested in and what could possibly go wrong, how our analysis, our result could possibly be poor due to this proxy not behaving the way that we want it to. I think in many cases, people have this idea that these metrics just exist, that we know exactly how many deaths occurred or how many infections occurred or how many whatever occurred in a population at a given time. The reality is it's more complicated than that. And all of these proxies, all these data sources that we use to get to that final figure really matter.
Are there any standards people follow? Like, I know the notion of what did a person die from? Some places they put one thing, sometimes there are 3 bullets or, just different changes like that that can dramatically change how a researcher needs to interpret the data. Are we approaching standards, or is that just going to be a problem you'll have to face in the field?
In some places, people are certainly approaching standards. And I'll put a caveat that there are certainly other individuals who are much more knowledgeable than me at those specific standards and how they're being implemented and where they're being implemented. We are approaching standards in some locations, but the issue is, of course, heterogeneity and who gets what information out of the system. There might be certain, for example, electronic healthcare records that exist that do a really great job of cataloging the distributions and determinants of disease within their given populations. However, does that data become available to the state public health system? Does it become available to the national public health system or the CDC or any other organizations? It's a little bit difficult to tell. So the bigger issue is just sort of the heterogeneity, the issues with data sharing, with data privacy, and data ownership that come into play with us being able to have some sort of national standard record. Now, there's a lot of people doing some really important and great work to help us move us in that direction. But it's difficult to say that the incentives are definitely in place for us to have something like that existing in the near future.
When it comes specifically to mobility data, in my mind, that's kind of a new thing. It's only somewhat recently that we're all carrying around these GPS information systems in our pocket. Am I underestimating the field? Is there a deeper history, or is it all pretty new?
No, so even before the sort of GPS era, so you're totally right. There's this kind of split, right? There's what we call CDR or call detail records, which don't need GPS information at all. So basically, every time you're walking around, you have your cell phone in your hand and it's making some sort of interaction with the local tower. There's some sort of information that takes place, right? That says that this handset was making a call at this tower. It went for this long. This is how much of a charge it should be, or is this roaming or not, or whatever, like 100 different decisions that the mobile network operator might make about that tower. So there's different levels of data. There's the CDR, which gives information about the call metadata, more or less. There's ping data, which is basically your cell phone as you're walking around is constantly trying to find what's the closest tower, what's the best signal. If I move further away from this tower and it drops and I connect to another tower, how do I keep the call going, or how do I keep the data connection flowing? So that information is oftentimes completely inaccessible because there's just so much of it. And oftentimes mobile network operators will delete that ahead of time. There's the CDR data, which we can get sometimes, but again, it really depends on what these mobile network operators are actually collecting, how it's being used already internally for any sort of operational needs, and what sort of case we can make for access to that data in some sort of reasonably anonymized and aggregated format. And then finally, sort of the next step up is, okay, let's forget about the tower level data or this aggregated tower data and talk a bit more about, okay, I actually have a device that can tell me my global position in my hand at any given time. So what sort of information am I getting out of that? So on that front, with the GPS data, it's no longer about what mobile network operator I have or anything like that, which is what you would need for the ping or the CDR data. It's now about the apps that are on your phone and what information they're sharing. So oftentimes, with applications that are on your phone, there's something called a software development kit that's on the back end. And it's like a library or package or something else that you might use to add a feature into an application. So for example, if you build in a mapping feature into your application, the app itself might collect certain types of data, but that SDK that provides that mapping feature, which is underlying that application, might also collect some information for their own purposes. Now, a lot of that information that's collected and that's generated, it already goes into this very sort of semi-opaque ecosystem of advertisement tech or ad tech. And it's basically different types of companies, some of them which actually publish the SDK, some of them which are providers of certain types of information. And then there's even aggregators who at different levels buy, sell, chop up, aggregate this data, put in their own sort of secret sauce, and then resell that information through some sort of value add that they believe that their aggregation or prediction system has provided them, and they sell it to marketers. So this very sort of nebulous system of advertisement tech then is able to provide information to marketers to basically have any sort of commercial product they might want on top of that, whether it's to sell you more stuff or to really figure out where people are going or what have you. That's that whole sort of ad tech ecosystem. And you might imagine that there's entities like Meta or Google that own the entire pipeline, right? So they're the ones that create the SDK, and they're the ones that under their various internal silos move this data along and then use it for marketing or whatnot. But then there's plenty of publishers out there who have SDKs that exist on phones, on mobile devices that are then used for who knows what purpose. And the challenge, we've worked with a variety of different ad tech providers over the past few years to figure out what sort of information might be useful for public health response here. And the challenge, of course, with all of this is that, again, that data generation process really, really matters. You can have, at the end of the day, the information that we're really interested in might be, are people leaving their houses more than we would expect them to? Or are people traveling around a lot and are they congregating in large spaces, potentially transmitting more disease than we would expect them to? Now, that might not be the information we get from these ad tech companies, right? So, for example, if one ad tech company collects data from, let's say, Tinder and Grubhub, you can imagine that the type of mobility or movement or location data that they get from Tinder is going to be very different than what they get from Grubhub or Waze or any of the plethora of different sort of applications that might exist on your phone. So they use it for commercial purposes. We try to use that same data for public health or social good purposes. And the biggest question, I think, is that a valid proxy for human mobility?
Well, you've asked the next question then, is it?
It really, really, really depends. And I think a lot of emphasis, much like in any of these other sort of surveillance or public health surveillance issues we talked about before, it really, really depends on having a deep understanding of the data generation process, right? At the end of the day, this is just a proxy for human mobility. And depending on how transparent that pipeline is, how easily we can say, okay, Kyle does this, and because Kyle does this, and then everyone in the region around Kyle is doing something similar, and this is how the data is kind of getting pushed together, and this is how it's aggregated. So now we no longer know who's Kyle and who isn't Kyle. But overall, in the county that Kyle lives in, this is what's happening. When that entire pipeline of how it goes from the people actually generating the data to the statistics that we get as researchers is clear, it's a little bit easier to say, yeah, okay, this makes sense. Looks like coverage in these counties is poorer than coverage in these counties. These are areas that we have a lot of confidence in identifying how people are moving and how their behaviors are changing. And in these locations, it's not really the case. But unfortunately, that's really rare. In many cases, working with ad tech companies, we're simply given sort of the end results and don't really have a good idea of who's generating that data. We don't know their age groups. We don't know any demographics. And in many cases, we have no way of saying whether these 2,000 people that we have from this county in this data set are representing 2,000 people from one city, or is this sort of a random, more or less distributed sample of people from that county? I know it's not a very satisfying response, but I would say that it really depends. There are some entities whom we worked with that we have much higher confidence in their data, and there's other ones where it's really just difficult to evaluate whether the data makes sense or not. One of the things that we did that's not in this paper, but in some of our other research during the pandemic is actually just pull information, so these mobility metrics, from a variety of different providers. So everyone from, your Googles and your Metas and all of them, and Apple, to small ad tech companies across the board. And we just sort of asked a simple question. So on March 15th in 2020, if you look at mobility data sort of across the board, you see that there's some sort of change that occurs. This is around the time when we first had some sort of national advice on whether people should be traveling, whether people should be sheltering at home, so on and so forth, in response to the pandemic. And we see very clear differences in how these metrics play out. There's usually big dives or big increases depending on if people are staying at home or if they're going out or what have you. And we asked basically just a very simple question. If I were to take this metric for these 10 different providers, let's say, and I looked at every county in the US for that time period, would they all be saying what we expected? Would they all be decreasing in value in the same direction? Would they all be increasing in value in the same direction? And if they're not, which one do we trust? And what we found out was really that just looking at that time period, looking at the 2 weeks before March 15th and the 2 weeks after March 15th, if you look at urban areas in the US, more or less, it seems that these metrics move in the same direction. There's still some disagreement, but it seems that they move in the same direction. If you look at rural areas in the US, and you don't even have to go to the most rural areas, the NCHS has a categorization of urban to rurality where it goes from metropolitan areas to non-rural areas. That's in 6 categories. And even by the time you kind of get past your second or third level of urbanicity, it becomes very difficult to say for a given county if X provider tells me that mobility is increasing and Y provider tells me that mobility is decreasing, which one do I trust? And there's a lot more disagreement as you go into more and more rural areas. So there's not just a difference between the different providers, but there's obviously a lot of heterogeneity as you look at the type of information that's being collected from urban to rural areas. And oftentimes during the pandemic, I believe this has led us to a lot of faulty conclusions about articles and news articles we'd see that say things like people in urban areas never stopped moving, and then there was an epidemic. It's really difficult to make that causal jump just using mobility data.
When you say there's a little bit more variance in the rural data, do you think that's due to measurement error, or is that the nature of the population?
It's 2 different things. I believe that behavior and then the values that we actually collect are very different, right? So, for example, one of the values that's oftentimes used in mobility data is the number of locations visited in a given time period, or some number of unique locations. And you might define it as the number of grid cells or the number of 600 meter by 600 meter spaces that an individual has spent at least 5 minutes in a given period of time. Now, you can already imagine that a metric like that is so heavily dependent on what sort of application you're using, right? If this is just the background app that I'm using all the time, great, I'll get a bunch of information. But if this is only when I'm using Waze, or this is only when I'm using Grubhub or what have you, I'll generate different types of information. So just doing this sort of mental exercise and thinking about this metric of the number of locations that you've visited in a given period of time, you can also imagine that rural populations have a very different baseline metric for that than urban populations might. If I'm in a very rural area and I'm basically just driving from point A to point B, and that might be the only time that I use these apps would be at point A and point B, I might have a lower number of total places that I go. But it also means that there's not just going to be as much variance there, right? So even when I have pandemic restrictions in place or what have you, I'm still going to be at my home. I might still go to church or what have you. I might still go to the grocery store, and my life might not change all that much. And in the metrics, it's going to look at it as if I'm not making any large behavior changes, but that's purely driven by the type of metric that I'm getting and the sort of rurality or the locations that I'm getting that information from. On top of that, rural areas generally tend to have a slightly older population in the US, and they have lower numbers of individuals from which we're getting this data about. So it becomes a bit more difficult to say whether this number of individuals that we're getting from this rural county are really representing the overall movements of everyone in that county, or if they're just representing even sort of what might be a more urban area within the county or what have you.
What does your raw data look like at the start of the analysis? What do you begin with?
It really depends on whether we're working directly with one of these providers or if we're getting end products. So if we're getting just end products from providers, it really runs the gamut. There's not really much of a standardization that actually goes on here. So it could go from anything to a line list that says for this location, for this county, on this day or this 24-hour period, this is the number of users we had, this is the average radius of gyration or the average distance that they traveled, or some other metric of interest, and it would just kind of provide a line list by day and county. In other locations, they might give you sort of grid cells and say that within this 600 meter by 600 meter grid cell, this is what was happening. So at the end of the day, what you'll have to notice is that basically it's just GPS points, right? And then they're parsed in a variety of different ways. And the things that change are the spatial and the temporal granularity by which they're parsed. So you can take any given spatial and temporal granularity and then calculate a certain metric for it. For example, the simplest being how many people spent at least X amount of time in this location. And then you can add other layers on top of that, such as radius of gyration, such as, okay, if I'm a person in this location, where am I most likely to go to in the next 6-hour period or 8-hour period or 24-hour period. And so it becomes challenging because, again, we either run the gamut of having very, very processed, aggregated data at very low spatial and temporal resolution, so maybe at the county on a 24-hour period, all the way to early on in the pandemic, before there were more sort of data protections in place, we could see individual level movements of people going through. And I and my lab during my PhD were very sort of hesitant to work with those types of data sets. Again, kind of going into the question of, does it actually give us information that's useful to provide a response, or are we just kind of hoping that this information is going to be valid, which leads us into this really kind of iffy space with privacy and anonymity that we wanted to be a bit more careful about.
Thanks to our sponsor, Neptune.ai. 99% of machine learning teams are doing really awesome things at a reasonable scale, with maybe 4 people and 2 models, not necessarily 100 people and 1,000 models. Yet most of the industry best practices come from the handful of companies operating models at hyperscale. The folks at Neptune.ai want to change that by sharing insights, tool stacks, and real-life stories from the practitioners doing machine learning and ML ops on the toughest challenges, distilling their findings for everyone. They even built a flexible tool for experiment tracking and model registry that will fit with your workflow at no scale, reasonable scale, and beyond. Check them out at Neptune.ai. Hi, I'm another one of those podcast ads that you've managed to tune out so effectively. It's okay, I get it. Listening to podcasts comes with some degree of ad fatigue. But today, you need to listen up, because I'm here to tell you about ad fatigue's sinister cousin, alert fatigue. Did you know the average company receives 11,000 security alerts each day? How can a security team stay on top of the most critical threat risks when they can't find the signal in all the noise? Well, they can't, which makes it easy for IT teams to fall victim to alert fatigue, making your company dangerously vulnerable. So you have 2 choices. Buy all the tools you can until you've made your security operations overwhelmingly complex and totally ineffective, or you can run with the pack. Arctic Wolf is the industry leader in security operations solutions, delivering 24/7 monitoring, assessment, and response through their patented concierge security model. Arctic Wolf works with your existing tools and becomes an extension of your existing IT team, and they never get fatigued. Got your attention now, didn't I? Visit arcticwolf.com/skeptic to learn more. That's arcticwolf.com/skeptic. Yeah, I've always been curious, though, if the ceiling isn't a little higher than that. Like, in theory, let's say there was a good system where I could opt in and anonymously contribute my data to researchers. I personally would want to do that, to contribute my data in that way if I trusted the system. But I'm not sure that depth of granularity necessarily benefits you. I've looked at raw GPS data. It's super messy, as you probably know. Lots of variance, lots of errors. You can definitely know I traveled to another city. But if I go to a strip mall, I'm not sure if you can know which store I went in. Does it even help if you get such deep details?
So it depends, again, to what purpose. If you're interested in better parameterizing your models to understand how populations move, or if there were an outbreak in a given city, where is it most likely to go to next, this population level movement data can have a lot fewer biases and a lot less noise than the individual level data. Now, if you want to go to the other end of the spectrum, kind of like what you're talking about, and you're more interested in where did people go and who do they interact with, you're absolutely right. It doesn't necessarily make sense to get GPS or ad tech data for that. And you almost need the types of systems that we've seen sort of implemented across the country and even places in Europe and in other nations where it's very individually driven. So you have a platform on your phone that's keeping track of individuals or other phones that has the same application, some sort of COVID tracking application, and then lets you know through that system if somebody that you'd come into contact with also reported that they'd become positive or what have you. So yeah, again, it just really, really depends on the purpose. A lot of the work that we've done is looking at the population level data, because there's certainly a lot in there and a lot about how humans move that we don't really quite understand, nor is it sort of very easily put into an abstract model. We do need sort of real data to tell us and better understand where people go and how they move and how that behavior changes over time. And that can be incredibly informative, again, in these models that look at the spatial spread of disease and areas that might be of higher risk or not.
To what degree can that movement be prescriptive of infection rates and things like that? Do you expect it to have a lot of explanatory power?
So if you want to think about it this way, let's say that we have a model and it's a nice spatial model that has an urban city in the center. And we talk about what happens if 10% of that city is infected or 20% of that city is infected. A big question that we'll oftentimes get next is, what do we do? Do we shut that location down? Well, honestly, everything that we've learned about mobility data is that those shutdowns don't always work the way that you would expect them to, especially if they're unilateral, right? So people still move, especially within countries and within areas where there's free movement. People will continue to move in certain ways. That's really difficult to restrict. So it's really about having a better understanding of that actual population flow, realizing that it's not often something like a gravity model, where you might say that this urban center in the middle of the spatial model is just sort of radiating out, and the further away that you get, your probability of somebody going there sort of decreases as an inverse square. That's not really what we see when we look at actual population data. It's a lot messier. People obviously like going to certain places and don't like going to other places. And perhaps most importantly, when things like disasters or sort of these exogenous effects come into place, it's good to know where people usually go at a given time period and how that's changed now, and how that change might affect how the disease actually spreads. So it's less about saying we think that there are going to be 100 cases of COVID in this location, and more about saying, well, this is our limited number of resources that we have across the state. We know that there's a large outbreak in this location. We know people are going to move in certain ways. Where should we pre-stage resources so that they're better able to respond in a faster manner when inevitably this disease or this epidemic might spread?
So I guess the key question to a lot of data science problems is, what decision are you going to inform? It sounds like a lot of public policy decisions could be informed by these types of models. Do I have that right?
Yeah, and everything that we do, it isn't just exploring and see what we get out, but really what can we inform based off of the results of this? If we're talking about population level movement, it really is understanding how that very unique way in which humans move between locations, how that can affect how the diseases move with those humans. If you're talking about the individual level and contact tracing, clearly we're going to sort of a different type of data set and a different type of response and operational objective, I suppose, at the end of the pipeline.
A lot of the noisiness I was describing of like GPS raw data kind of goes away when you get into an aggregate performance. You can kind of see better trends, or at least that often happens. Sometimes the signal emerges from the noise. Other times it doesn't. Do you get a more clear picture when you start to look at movement data from like city to city, or is there still some data processing to be done?
There is a certain amount of data processing to be done. And of course, that also goes back into how these data actually inform your model. So at some point, you manipulate the data, or transform it rather, to be able to actually inform the models. So you take, for example, raw numbers of individuals traveling and convert that into a estimate of how much they used to travel in the previous 3 months, let's say, compared to how much they're traveling now, and then use that to tune how much individuals travel in your model or not. So of course, there's transformations that go into place, and they can be informative. So we've seen that between large population centers, these type of ad tech data can be incredibly, incredibly informative. But again, when you get down into the smaller scale and you get into areas with less information, fewer people moving around, it becomes a bit more difficult to really say if a certain movement is representative of that entire population, or if it's representative of the 20 people that happen to be contributing information from that region. Again, I think this becomes really, really tricky, because the further you dive in and the further you get into these small rural areas, the more noise and variability you will almost inherently have. But unfortunately, on our end as researchers, and the way that these data pipelines exist now, we might not have a good idea of even the number of individuals that are contributing information to the data sets that we're using or that are provided to us by these providers. We might not have a good idea of the biases in the apps that are collecting this data, the biases that exist in the way that these different companies actually put these data together and provide it to us. And it's this really weird in-between space where we really are kind of at the mercy of whatever these companies decide to provide to us.
Yeah, I was talking to someone recently who had a similar problem where they would send samples of something to a lab, and the lab would either give them a measurement or they'd say less than 5%. So, well, that's not a number. What do I do with that? I need something for my model. What can you do? Ultimately, you have to make some choice. How do you manage it in your analysis?
We try to be as clear and transparent as possible. And that includes having some sort of uncomfortable conversations with the people that have provided this data and saying, we can say this, but we really can't say this other thing. We can't say that there are X number of users or what have you if you're not providing us with the actual user counts. We can't say that we have a high confidence in every single small area when we don't know how much variability or what sort of noise exists around these measurements that we're actually using. And to be fair, some of these providers have sort of gone back, changed their methodology, tried to make things better, but it's still sort of in this in-between space where, as researchers, the best thing that we can do is be brutally honest in the way that we provide a response, be honest about situations in which these models don't work as well, or these data might not be informative, and really drive towards better understanding this data generation pipeline. Because at the end of the day, that's really what matters, not taking these data that come to us at face value, but really being more curious and more skeptical about what they're actually telling us and whether they're good proxies for the measurements or behaviors that we're interested in.
It's not clear to me that there's any real notion of ground truth in some of these measurements. I mean, for sure there's not, because someone could become sick in their home, self-quarantine, and get better, and it's not like they call a hotline to report themselves that way. There's always an imprecision to the figure. With that in mind, how do you think about model validation?
Yeah, so using these mobility data, we're trying. So, one of the organizations that early on in the pandemic, we were just working nonstop. Our lab had a lot of history working with these mobility data, and we were working with a bunch of ad tech companies and also Meta and a bunch of other sources to really make these data available to local policymakers, everything from national to state to county to even city specific decision makers who could use these data and then make certain decisions off of them. And it became incredibly difficult. There's this sort of trade-off, right, where the decision makers want a dashboard or want a stoplight figure or something like that that says good, okay, bad, or what have you, and then they make a decision off of that. But the data aren't really informative enough to say something like that. And so as we were working kind of nonstop early in the pandemic, we started off by forming the COVID-19 Mobility Data Network to have different researchers around the globe come together, talk about the issues with these data sets, and sort of standardize the way that we were providing this information. And this eventually spun off into an organization called Crisis Ready, which does not only epidemiological work, but also disaster response using these mobility data. The reason I bring all of this up is that in an ideal world, there would 100% be some sort of validation that we could do against this, right? We could say that these are the data that we have for 100,000 people from all these variety of different sources. And then these are the surveys that we actually conducted with them using an app on their phone to see where they actually went. How often does this agree? How often is it very, very far apart? I think it's a multifaceted issue. First, it's coming more and more into sort of the public consciousness, but I think a lot of people just use their phone and don't necessarily realize the incredible amount of data that they're generating. How that data is exactly used. We see these long forms on an app every time we want to use an app or we download a new one that is talking about the data use policy and sharing and all this other stuff. But more often than not, we just kind of scroll all the way to the end and click OK and kind of move on. So I think at the highest level, this comes as a bigger question of who owns the data that we generate? How is it used? Do we have ownership? Kind of like you said at the beginning of all of this, can I just say, hey, Kyle, do you want to kind of participate in our study and just donate us your data and we'll kind of go forward from there? Or does that data belong to these ad tech companies? Does that data, as soon as it's pulled off of your device, is that data somebody else's? So I think that there's a bit of a maturing or introspection that needs to be done on how these data are generated, who owns them, and how we can best benefit of them as a society. The way that they exist right now, it is very much driven off of a commercial infrastructure that uses it for more often than not things like marketing or even improving your experience on these applications. That optimization that's being done for marketing, commercial purposes, improving experience on the application might not be what's best for getting information about who's sick, where are they going, and what interventions could we possibly do to reduce the burden of morbidity and mortality in our society. So yes, I think a validation study is incredibly important. We are in the process of trying to figure out the best way to do something like that. But I think that there is this larger issue of what incentives do these companies ever have to actually share this data back, to provide it in a format that's useful to do any of this extra work when that isn't in any way regulated or that it isn't in any way something that they're required to do. Tomorrow, every single provider that we work with could easily pull up their stakes take all this information away, and there's not really any recourse for us as investigators to get to that data again.
Yeah, it's a little kind of scary in a way that a service could disappear that might be contributing to smart public health decisions. But at the same time, I know people still have Cambridge Analytica in their mind, sort of like the negative case. Do you have to fight that experience, or do you think the public is becoming conscious of the importance of this data for public research and things along these lines?
It's one story out of probably a few hundred, right, of things that have happened, of acts that shouldn't have occurred. As a user of a lot of these services, and then as a researcher who looks at the back end and tries to see what we could actually learn from this, there is still that sort of large nebulous space where all of these data are already being used for commercial purposes. I think people would point at something like Cambridge Analytica and say, this is terrible, and I would certainly agree. But I wonder how they would feel about their data being used to target more advertisements to them, or do any of these other 100 things that are being done with their data already that is not for any sort of public or for social good. I think we've matured a lot since Cambridge Analytica. Access to these data sources and the layers of privacy that are built on top of them are increasing quite a bit. And in fact, one of the pieces of research that we've been conducting recently deals with differential privacy. So basically, we are trying to look and determine and say, okay, so we have this data set of mobility data coming in. What if we implemented a layer on top of differential privacy, which provides us a statistically defensible mechanism through which we can guarantee a certain level of anonymity for an individual in our data set? And so if we apply that layer on top and we tweak how much noise we're adding to the data set, because at the end of the day, that is a lot of what differential privacy does, right? It adds noise so that it becomes really difficult to say that this is the one person, or this is the one type of trip, or this is an individual that we can target. You can't really add more information to that to be able to identify some individual in your data set. We tune how much of that noise we're adding. And then on the other end, we use those data sets with noise added in a simulation model and determine how long it takes, how much noise we have to add before we start biasing our results quite heavily. So for example, if the result of a model might be, this is our expectation of synchronicity between epidemics in different regions in New York State if an epidemic started in New York City. Or it might be, this is the overall end size of the epidemic, so the number of individuals that are infected, or the number of individuals that we would expect to be hospitalized, or any of these other values that we're interested in as a model. And as we tune this noise parameter, how much do those end values change from the quote unquote truth, which is no noise added? And what we're finding is this is, again, a very reasonable and very defensible way to add noise and protect anonymity, but you can add quite a large amount of noise and still have very little bias in your end results if what you're interested in is these large level population models. So this large level sort of how are people moving between regions and how does this affect the overall transmission dynamics of a given epidemic. And so this would be, for example, a really great framework that could be applied on top of almost all of these different types of data that we're talking about. The question is, what incentive do these providers have to actually do that and then to make this data a bit more available? And we'll continue to do this research to try to elucidate what this pathway looks like. But there's always going to be, I think, this more philosophical or governance question of what is the incentive for any of these providers to share the data? Is there a duty to share, especially when there's a disaster, when there's an emergency, and what sort of funding structures or what sort of incentive exists now to allow the research to build that pipeline? And unfortunately, there might not be a purely commercial solution to all of this.
Where can listeners learn more about Crisis Ready?
So you can check out www.crisisready.io. We have a bunch of work that we've done recently all around the world, but our two largest outputs to date have been looking at where Ukrainian refugees are going after they've left Ukraine. So none of the work in the country of Ukraine, but better sort of understanding where the location where refugee responders should be going to provide resources, where should shelters be open, so on and so forth, to try to see and get a better understanding of how this diaspora of individuals is spreading and disseminating through Europe and through other locations. And then the second one is looking quite a bit at wildfires in California and in a couple other states in the US, using some of these mobility data to understand where people normally go in response to disasters, how that changes as actual fires start and people start moving, how remote sensing can help us get information about the smoke plumes and where they're traveling, the locations that can expect an increase in burden of individuals needing emergency care, so hospital systems that should be sort of ready and prepared and so on and so forth to respond, again, based off of this remote sensing and mobility data.
Do the same methodologies you applied in the primary paper apply in these cases, or do you need different techniques?
A lot of it really just comes down to being very, very skeptical of the initial data source. And I understand this is the title of your podcast, so I'm not trying to make puns off it over and over again. But I think it really comes down to that. We're still at a stage where we're trying to standardize some of these pipelines to really figure out how this response works, what data do we know are always going to exist, and how do they eventually lead to some sort of decision that policymakers or responders are able to take based off of that data. Right now, since we're still sort of in the nascent phases of this, it almost always requires a researcher, somebody who knows this mobility data, going in and really heavily interrogating it, having a deep understanding of when it works and when it doesn't. So, for example, in response to one of the fires that occurred in Colorado last year, we were really interested in looking at where people were moving and what hospital systems might be most burdened by where people were going. And one of the challenges we had, of course, was that one of these fires in Colorado was in a fairly remote area. So all of a sudden, these mobility data that we have that we already know can be very noisy and not very informative in rural areas becomes one of the few sources of information that we have for how people are moving. And so it requires a lot of ground truthing. It requires a lot of work. And by ground truthing, I mean working directly with the responders and saying, hey, we think that there's going to be an increase here, or there's people moving in this direction. Does this make sense? Hey, we think that there's responders going the opposite direction. That's why we see all of a sudden flow going into the fire areas. Does this make sense? This is where people are coming from. And then providing that information back to those users. I think we're still, again, in a very nascent phase with all of this, where we're trying to figure out the best way to provide this information. And unfortunately, at the moment, that still requires a fair amount of legwork on our part to interpret and understand the data and then provide it in a way that's easily digestible to sort of a much larger population that's going to be using the outputs.
What can we learn from the existing work you've done with the aggregated mobile data and looking at mobility data? Are there any takeaways that you think are ready to be passed on to like a policymaker or someone like that?
Yes, I would say don't just use one data source. Oftentimes, different data sources, especially if you're within sort of the ad tech space, will use data from different applications or different groups of people. And you really kind of want to come at this as more of a triangulation exercise rather than, oh, this is our one data source and this is the response that we're going to get. The second thing I'd say is that really take the time to validate what your model outputs are saying. So if the model says that there's going to be a ton of people moving from location A to location B, talk to the responders, get the ground truth, figure out why something is occurring or why something is not occurring. Third, I'd say be very, very, very careful of remote areas and honestly, just any non-urban areas. As you start to get away from urban zones, the data can be much, much, much less reliable. And most importantly, the population that they represent isn't clear. So until that becomes clear, until there's a methodology by which we can say this represents X people, but it's probably very skewed in these demographics or these age groups, it becomes really difficult for us to really understand what's going on. And then finally, something we've talked about quite a bit during this interview as well is letting a question drive the outputs that you can get from this model rather than just using these data and running something and getting outputs and then trying to squeeze it into some sort of policy decision. Especially in the beginning of the pandemic, there was a large number of providers who came up and said, here's our data, do whatever you'd like with it, or here's a dashboard, or here's whatever it is that you would want. What we oftentimes found is that there was a bit of a gap there, how these data could be used versus the responses or the actual information that the policymakers wanted to be able to make a decision were slightly different. And so letting policy drive the analysis rather than, or at least at the beginning, letting what you're actually able to do or what information you need to drive policy, drive the type of analysis that you do, rather than just doing whatever analysis you can and then figuring out how it fits into policy.
Yeah, good advice. Well, we've touched on some of the features that were involved in the model, but now that we're kind of in the results area, I'm wondering if you could comment on what were some of the most informative features that helped come up with good decision and movement results.
I would say that one of the things we found is that the relationship between something like the effective reproductive number of SARS-CoV-2 and mobility changes or can change quite a bit. A model that is incredibly well fitted with a ton of information at a certain point might change when it goes to a different epidemic phase, right? So, for example, early on in the pandemic in the US after March 15, 2020, a lot of metrics that calculated how much people were moving or where they were going decreased or just, almost went off a cliff. And at the same time, we could see that the effective reproductive number was also decreasing. Now, the question isn't, is one predicting the other to me? For me, when I look at those two metrics, the biggest thing I come back with is that the effective reproductive number is being calculated using cases and deaths in a certain area. The mobility data are being calculated using some sort of proxy for human mobility, ideally in those same areas. But we don't know if the populations are the same, but the factors that make people change their behavior and then the factors that lead to the production of disease aren't necessarily perfectly linked, right? So people could still be moving, but all of a sudden they're masking more, they're vaccinated, or they're practicing some sort of social distancing, or they're still moving, but they're being a bit more careful about being in indoor spaces, so on and so forth. All of a sudden, the relationship between movement itself and the production of disease can change. So this paper, a lot of what we look at is that relationship over time. And what we find is that in the early periods of the pandemic, so really kind of in March, April, May, June of 2020, there's a great link between mobility and the expected reproductive number. As people stop moving, the expected reproductive number, the effective reproductive number also decreases. But again, as the pandemic moves on, that relationship kind of decouples. And perhaps most importantly, even at the very early stages where our model does an incredible job of linking the effective reproduction number to mobility, it performs abysmally in the most rural areas. So in the most rural areas, there's still so much noise and so many different ways in which these mobility metrics move that it doesn't necessarily provide something that's useful for policymakers. But again, it becomes a challenge because if I'm a policymaker in a rural area and somebody provides me a dashboard saying that mobility is increasing or decreasing, it looks like a great data source and I might want to jump on it. But again, our responses from the mobility data and from the study that we conducted really kind of looked a bit more at that and said the relationship changes by both urbanicity and by the epidemic stage that you're actually in.
Well, in the future of things, where do you think we need the most work? I know we've talked about maybe the data generation process. Is that really the limiting reactant?
The data generation process is kind of like a layer on top of it, but really underneath it is our understanding as a society of what we want to do with all of these data that we generate. On a year-to-year basis, we produce more, we have new gadgets, we interact more with the web or with our phones or what have you, and all of these interactions generate more and more and more data. I think the more interesting and perhaps important question is really, what do we want as a society? Do we want these data to be owned by us? Are these data owned by the companies that provide these services for us? Or should there be some sort of duty to act for these companies? Because again, there's no real incentive structure right now or requirement for the companies to ever share these data. Should there be a duty to act that allows researchers or responders to say, hey, normally this isn't something that we would do, but there's been an earthquake or there's been a hurricane, and we need to get a better understanding of how people are moving and where they're going and to better direct resources. Something like that, sort of at a more philosophical or governance level, is really necessary to kind of give this the next oomph that it needs. I think that these data can be incredibly useful, but in the way that they're created, aggregated, and put together now, researchers and even sort of the general public ends up being another client for their data rather than somebody who's able to use these data and optimize them for the best public health result.
Good observations for sure. Well, Nishant, where can people keep up with you online?
You can check out my Twitter at nish_epi. And of course, please continue checking out work done by CrisisReady, crisisready.io. And you can check me on LinkedIn. There's a variety of other organizations that I'm involved with, but regarding mobility and how we can best use that to provide the best gain for society, certainly those two locations.
Great. We'll have links in the show notes for people to follow up. Thanks again for taking the time to come on and share your work.
Absolutely. Thanks for having me.
That concludes another installment of Data Skeptic Physically Distributed. Thanks to our sponsors, Neptune and Arctic Wolf Networks. Myself, Claudia Armbruster, as associate producer, Vanessa Bly, guest coordinator, show notes written by David Abembe, and our host, Kyle Polich.